Hello, my name is Justine Morrison and I'm going to be presenting to you how to give yourself an insulin injection using an insulin pen. As you may know, your doctor's prescribed you insulin due to your blood sugars being too high. If you do not feel comfortable giving yourself an at-home insulin injection, or you're unsure of why you've been prescribed insulin, be sure to talk with your doctor before giving yourself any injections. Also, before giving yourself insulin, you need to check your blood sugar. This should be done using a glucometer. After you've checked your blood sugar, record it on a tablet or a piece of paper to take with you to your next doctor's appointment. If your blood sugar is below 70, call your provider to be sure that he would like you to give yourself your insulin. At times, this can cause your blood sugar to go below 70, and you may feel the signs and symptoms associated with low blood sugar. After you've checked your blood sugar, you then need to gather your supplies. This includes an insulin pen, an insulin needle, and an alcohol swab. After you've gathered your supplies, you then need to check over your insulin pen. This includes checking the expiration date, which should be labeled on the pen. Also, manufacturers state that 30 days after your first use or piercing the needle vial with a needle, your insulin is expired. So be sure to mark that date somewhere on the pen where you can clearly see it, or on a piece of paper where you know you will not lose the piece of paper and you can check back to it as a reference. After you've checked the expiration date, you then need to check over the medication. Typically, fast-acting insulin such as Humalog or Novolog, or short-acting insulin such as regular insulin, R or N, and 24-hour acting insulin such as Lantus have a clear appearance. Insulins such as longer acting insulins like NPH have a cloudy looking appearance. Be sure to look over your insulin before giving yourself an insulin injection. If it doesn't look right, do not use it. After you've checked over your insulin pen, you then can prepare yourself to give yourself an insulin injection. First, start off with removing the cap and swabbing the top of the vial with an alcohol swab. This removes any bacteria and prevents contamination from entering into the insulin. This should be done for about 10 seconds. Next, place the insulin needle on top of the pen. This should be done in a straight fashion so you do not bend the needle, and remove the cap. After you've placed the needle on the pen, you then need to prime your insulin pen. This should be done using 2 units of insulin by setting the bottom of the needle to the number 2. This should be done by turning it to the number 2 and the arrow pointing at the number 2. Then place the needle in an upright fashion and push it upward. You should then see a squirt of insulin from the top of your pen. If you don't see this squirt, that could mean that your insulin pen is empty or the needle is bent. You should repeat this process again. If you still do not see the squirt, then you may try changing the needle, or you may need to replace your pen and get one that has insulin in it. After you've primed your needle, you then can be ready to give yourself an insulin injection. First, find an area of the body that is a fatty area. This includes back of the arms, hips, or abdomen, at least 2 inches away from the umbilicus. Try to avoid areas that have moles, scars, burns, areas of inflammation or infection. These do not absorb insulin very well. Also avoid areas that are highly muscular, for they absorb insulin too fast and that can cause you to have a low blood sugar. After you've found the appropriate area, wash your hands. This can be used doing an alcohol-based scrub or washing them with soap and water. Next, set the dose on your insulin pen. For this demonstration, I'm going to be setting it to the number 12. You will hear it in a clicking fashion until you get to the number. Next, find the appropriate area of skin that you would like to use. For this demonstration, I'm going to be using this on my abdomen. After you found the area, scrub the area using an alcohol swab for at least 10 seconds to remove any bacteria and prevent contamination from entering into the skin and causing an infection. Next, allow the area to dry. After the area is dried, pinch the skin, causing a nice fold so that you can give yourself an insulin injection. Next, grab your pen, holding it like this or in a dart-like fashion, and hold it at a 90-degree angle at skin surface. Next, push the insulin needle into your skin, directly into your skin. Afterwards, push the plunger, injecting your insulin into your skin. Then hold the dose there for at least 10 seconds. You should see this number go to the number 0 and count to the number 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then remove the needle in an outright fashion. You should hear a click. This means that the insulin has caused the safety guard to go over the needle. Next, remove the needle and place it in a sharps container. Never leave the needle on there because this can cause bacteria to enter into your pen and cause it to be contaminated between usages. Next, place the cap back on your pen and you have given yourself your first dose of insulin. Thank you for watching my presentation and I hope you enjoyed it.